So we then worked with the company to come up with a solution. In this case, we wanted to eliminate EDCs, chlorine, and paste on the material, do disinfection, and produce high-quality soft water. Okay, and then we did it. We did a 2 years study with the help from ITS as well as with the company. So we are able to demonstrate, okay, in different type of water matrix, we can in fact remove all of these EDC materials. Okay, we can actually mineralize it and get it into very well form. And then simultaneously, because this is an ITF product, we have to come up with a real prototype that can be commercialized. Okay, because there's two companies that are sponsoring us. One is an appliance company, so we come up with an appliance prototype. And then for the other company, which is a large-scale company, which is Veolia Waters, we come up with a scale-up model for them. Like, for example, we did a scale-up study. Like, for example, 50 of these type modules is sufficient to supply all the Hong Kong water need, okay, to get it into the standard that you don't have any of this chemical present, okay, in the materials. So this is just a project that we just finished. So it's a very interesting topic because like it do have a long-term impact because a lot of this EDC actually affect the young people more, okay, especially child, okay, they are much more susceptible to these materials. The other one that we would talk about is resource recovery, okay, this is about nanosorbent. Precious metal recovery. Okay, when I started this project, it's funny because like when I was designing this nanoadsorbent, I was trying to demonstrate it for very systems that are very difficult to separate because like in terms of science, that is the important part. But then nobody's interested. Why do you want to separate copper from nickel? Okay, why do you want to do that? So finally I said, okay, I have to change my tack. Okay, how about separating gold from copper? Now that get people's attention, correct? So the study that we did is like to do platinum, palladium, gold, and silver. Okay, so but those are easy for us. It's easy. Okay, we were then connected with the African mining company. They were very interested because the African government is pushing the industry to move from the cyanide process, okay, to a Wooler process, which is a chlorine process. Now, the POO process may sound very simple and straightforward, but there's a very important difference. Because the cyanide process, they can use activated carbon to get the gold, okay, and then burn it away, and then they can process it. But the Wooler process, the activated carbon doesn't work. So they were very interested. They worked with us, and then we helped them develop an adsorbent, okay, that can recover gold, okay, from the solution. We have mixture of all the base metal, so you put it in, it will only absorb the gold, okay, and then you can then wash it with acid, and you get about like 90% of gold back, okay, 98% purity gold back, okay, and then we even work with them so that they can first separate the platinum and palladium, because they told us for their mining, for the processing step, the most expensive part is actually to remove the platinum and palladium, okay, from the gold, because those melt at very high temperature. So this process allows us to remove it first, and then later on remove the gold. So they were very happy about these results. Okay, so I'm stopping here. Okay, with no conclusion. I do other research in energy, and I hope this is a conversation. Okay, so thank you.
The professor has shortly, in 25 minutes, has covered 4 different, very diverse fields. I don't even know where to start. So can somebody please start by asking a question? Oh.
Your water treatment
Yes.
Research, are you in touch with the Water Supplies Department? Is there
Yes.
any likelihood of its being applied to the supply of water, the treatment of water in Hong Kong, so that we get better water out of our taps?
I think they should be aware of it because it's reported to ITF, and then part of the panel that are reviewing the results are actually they are part of them. And in fact, like this technology, part of this technology is actually being implemented in France, okay, in Paris, okay. Because in the Paris water, they draw their water from the Seine River, which over the years they have accumulated like industrial chemical waste. So they have been applying this. Okay, so they had done a pilot scale test on this technology.
So John, where can we get from here? Can we get in touch with the water department in Hong Kong, or to have them help sponsor us to have better water system here in Hong Kong?
Or yeah, or the other one is the small water purifier. Okay, so that is a small system. That one, I think, for Hong Kong is a much more big business opportunity because, like, you can sell it, as a product.
So, do you mean we can get a commercial company to come up with this filter system and put in home?
Oh, it's small. It's like we already make a prototype. This is a prototype system. Okay.
Oh, Peter.
Thank you, Professor Yeo, for a very informative, innovative talk. Maybe I'm a medical guy, so regarding your first topic, the coating.
Yes.
You didn't mention any biochemical structure of the material. I don't know. Maybe I missed it.
Yeah.
So is that actual antibiotic type of material?
No. Because we try when we did the screening for the biocide, we actually avoided some of the chemicals that are actually targeting the metabolic pathway because most of the bacteria can find their way around that. So what we did is like we look at only chemical that actually oxidizes. It's an oxidizing chemicals. It's an oxidizing biocide. So basically what it does is it damages the external outer wall of the microorganism. So it becomes multi-spectrum. So it's not dependent on the species. Yeah.
So it can kill bacteria,
virus and spores.
And
spores.
And spores.
Yeah.
Okay.
Yeah.
Okay. But you do have a biochemical structure of the, like, whether it's a pharmaceutical product or just a non-pharmaceutical product?
It's a non-pharmaceutical product. We avoided pharmaceutical because of the fact that, number one, it's too expensive, usually. Okay. Secondly, if it is pharmaceutical, tend to be metabolic. Okay, and then the bacteria can circumvent that. Okay, through selection process. Yeah.
On the second topic,
Yes.
the painless needle.
Yeah.
I don't know, but by the way, in this year's flu vaccine,
Yes.
we're getting a painless preparation by I think it's Sanofi, and it costs twice as expensive.
Yeah.
And then I'm ordering that for all my patients in the clinic because they don't want pain. So they say it's like you just feel a scratch. So it's a painless needle. I don't know if it's the same.
I think that they do a topical analgesic application right on the needle, so that you have a topical.
So you don't feel any
pain.
You
don't feel it in the Okay.
Thank you, Professor.
Thank you.
Any other questions?
Yes, thank you very much, Professor, for a very interesting talk. We make zippers. The interest about the biocoating is now its application obviously will be quite wide once when it gets fully developed.
Yes.
The interest from my point of view is now the coating will evaporate after a certain period. And the evaporation process, will that produce anything to sort of pollute the environment?
We did because like this is one of the issue that we were quite concerned about, because part of the study that we did in the Tuen Mun Hospital and also in the Queen Elizabeth ICU hospital is to number one, to look at the environmental level of these materials. So they are below the detection limit. Okay. We also in the ICU ward, we also monitor the neutrophil level of the patients because we were concern, like if we are injecting, if we are releasing something into the environment, will it have any allergenic effect from the patient point of view? So they did that, okay, because that is the first thing that they did before they allow us to go into the ICU. And then the third thing we also did internally within the campus, we did a 1 month study on the in the computer barn, okay, our computer classroom. And during that period, we basically announced to students that we did coding, but at the same time we do blind study. Okay, part of them are coded, part of them are not. Okay, and then we try to monitor for any reactions from the student, either skin irritation or other type of reactions. So we found out that there was none during that 1 whole month period that we are not doing it. And we even did a survey, okay, on wherein we specifically asked them whether they have a skin reaction. Now that tells me like the double-blind test is very important, because we have 2 students that mentioned that they had a skin reaction, but they were using the computer without any coating. Okay, so for us it's very very good, because we ourselves doesn't know, because the person who code, he kept the tag on the computer. Okay, and then the one that do the survey doesn't know what it is. Okay, so there's no, so this is the way that we try to get very honest opinion. And then the Queen Elizabeth Hospital, they also did an internal survey on their own medical staff and nursing. Okay, to find out about, number one, whether the medical item coated with this material will have a different feel from the one that is uncoated. In that case, they actually tell them directly, okay, this is coated, this is uncoated. You do a comparison study. They also ask them whether they have skin reactions. Okay, so this is some of the issues that they were very concerned about. So actually working with people that are actually in the field educate us a lot, because like there are many things that if you are doing it in the lab, you will not think about it. Okay. But once you go deal with the doctors, patient is the number one concern that they had. So they wanted to make sure, okay, whatever product that you bring, the first thing that it should do, like, is not to do any harm, okay. So that was what our experience with them, okay. So.
Thank you. I asked because obviously it has a lot of very good commercial applications, and we're just looking forward to when this product could be on the market.
We do have the formulation. We are now gearing up for a production. One of the things that we were planning is like for this December to give some Christmas gift to the hospital, because they have been helping us a lot, okay? And then the nurses and the medical doctor will keep on bugging us, when can we have it, you know? So I said, okay, so this December we kind of hunker down, and then we'll start some production from the lab, you know, just as a gesture of thanks to them, you know, so.
Thank you.
Thank you.